Hello and welcome, it's Chris from Christopher Holt Training, and welcome to this short little tutorial where I want to talk a bit about people move better when they have a bad back. So there's a lot that people can learn from having a bad back, albeit not the greatest situation to learn that. So in some respects, you can learn good movement for the sake of moving better whilst you feel better, or when you get the bad back due to poor movement, you can then learn about good movement in that moment. Because when I work with people, if they come in to see me with a bad back, they will generally move around a lot more effectively and a lot healthier than if they come in, they don't have a bad back. They'll just kind of, sit down, get up off the floor in any way, shape or form. But when they've got a bad back, they really think about it. And there's four things that I want to go through that they are doing when they have a bad back, but when they aren't necessarily doing all the time when they don't. So when they don't have a bad back, they're a bit more complacent, but when they have a bad back, they really focus on their movement and how they go about doing it. So the first thing they focus on is holding their spine in more of a neutral, that natural S curve. So when they're getting up off the floor, when they're getting up out of a seat, or if I'm asking them to sit down on a bench and get back up, they will maintain that position of the spine a lot more effectively than if they are just not in pain and just getting up off the floor or getting up out of a seat or whatever it might be. The second thing, which is sort of highly linked to that, is they will hip hinge. So if they are maintaining a proper position of the spine, and then I ask them, can you just sit on that bench or can you just sit on that seat for me? They will approach it. They will then hinge at the hip because they won't bend their back because that will feel vulnerable. So they'll hinge back at the hip and they'll sit themselves down. I'll then ask them to get up and they'll work in very much the same way. They'll sort of lean forward at the torso and then they'll hinge at the hip because they won't want to bend their spine, and then they'll come on up. The third thing is the brace. So these are, or all four of them are linked together, and I'll explain them in that way. But when I ask them to get down onto, let's just say a bench, again, use that example, is they will, again, they'll maintain that neutral posture, they'll hinge at the hip, and they'll brace their stomach muscles. Because all that's doing is the neutral spine is keeping it in what's called its elastic equilibrium, which is just maintaining the tissues evenly throughout the spine. They're bracing their torso, so it's any load that does go on the spines gets spread around the whole of the torso, and then they hip hinge, so they aren't then flexing out of that position. So all of those together is helping them with their bad back. So they'll go down using the neutral spine, the hip hinge, and the brace. I'll then ask them to come back up, and guess what? They'll do exactly the same. Neutral spine, hip hinge, and a brace. And then the final thing is they'll be more slow and controlled. They'll think about what they're doing, because if they don't think about what they're doing, their back is going to catch them. So if they go into a bad position, they'll kind of move into a bad, and then they'll come back up out of that position. So all the time they're thinking about, is this a good position for me? So if we put all that together in that sort of getting down onto a bench or sitting down onto a bench and then sitting back up off of that bench, they will do it in a very effective way. So as I've mentioned, they'll be in that neutral posture, they'll brace their abdominals, they'll hinge at the hip, and they'll move in a controlled manner. Now, when sort of learning not only to overcome a bad back if you've already got one, or how to maintain a healthy spine for, just maintaining a healthy spine, you don't have a bad back, this is how you learn movement. You work on it sort of piece by piece, but you've got to be slow and controlled so you can think about it, so you can focus on the position. Because when I will work with someone and I give them a big movement, which involves arms, torso and legs, they will think about moving the weight where it needs to go. They won't think about, right, what are my hips doing? What are my knees doing? What are my hands doing? What's my torso doing as I rotate, or whatever the movement is? So we have to break it down to be able to get the legs moving in the right position. Okay, can you feel that? Yeah, I got that. Yeah, I can understand that. So you do that, slow and controlled, potentially move it a little bit faster if that's what it requires. Then you move up to the torso. You sort of segment the body off, and then you do the same with the arms. So you're segmenting the body off, getting all the movements of the different areas of the body, and then you can start putting it together. So you might do just torso and legs to start with, or arms and torso to start with, and then you add the legs on at the end, or if it's the other way around, you would add the arms on at the end. So you can then sort of get them to focus on all these different bits of movement. So as I'm working with people, this is the system and the method that I'm using, because I'm not only training their body, I'm training their brain to be able to have good competency when it comes to doing that movement. So for example, if we take that sitting to standing, what we have to do is I might just get them to sit on the bench. Right, all I want you to do is just hinge forward at the hip. So don't worry about getting up. I just want you to sit there, hinge forward, just to get the weight shift forward. What we can then do is then bring the legs in after. So it might only happen over a minute or two's period, but what I want them to get is what's going on in there. So if you have a bad back, this is how you need to train. If you don't have a bad back, this is how you need to train, because all I'm essentially doing is just teaching you how to use your body correctly. Be that with a bad back in a very, let's just say, beginner's setting, or if we're in a more exercise fitness setting or strength and conditioning setting, it's exactly the same. I'm just saying, right, this is how you use your hips, and this is how we want to use them in this movement or in this posture. This is how we want to use the arms. This is how we want to use the spine. This is how we want to use the muscles of the torso. So whatever the setting is, those anatomical principles are the same. It's hinging at the hip, neutral spine, bracing of the torso, and then that's, depending on the movement, if we move into a fitness setting, it's then a slow and controlled movement. This is how we begin the learning process. What we then do is we then repeat that. That then allows the brain to remember it. So it's not just a case of doing it once and going, right, okay, that's what you need to do, off you go and do it. It's very much, it's that repetition, because when you start looking at habits and things like that, you learn about this thing called myelination. All myelination is the brain having the patterns, or the body having the patterns repeated, so the brain lays them down, ingrains them, makes them thicker, makes them stronger, and makes them more natural and habitual. So when it comes to working with someone, this is the methodology and the process that I'm using. So yes, we've got to use correct movement, but we've got to do it in a way that not only that your brain can understand it, but also that your brain can remember it for a longer period of time as well. So yes, it's a bit of work. Yes, it takes time, but in the long run, that's the most effective way to train. So if you are struggling with a bad back, go to the link below, click through to my online remote lower back pain consultations. Obviously you can find out a little bit more on the page. Click through and do the initial questionnaire. That will come through to me. I'll fill that out. You'll fill that out. I'll have a read through it, and I'll then get back to you with advice and recommendations. What will then happen is, if we need to, we'll do a self-assessment, and then we'll be able to follow that up in a week or two's time. So that's how I work with people online. Obviously, the process is the same if you were in Bristol or surrounding areas. So the process is the same, it's just we would do some of it face-to-face. So if you do have a bad back, please do go along there. Oh, you can also, if you do have any more questions for me about it, there is a comments and questions section on there. So you just scroll down to the bottom of the page, I think it is. Just put your name, your email, and your message in. Again, that will come through to me. I'll be able to answer that, and then we can go forward with helping you overcome your lower back pain. So many thanks for watching. Hopefully this has been helpful for you. My name is Chris from Chris Pole Training. I'll speak to you in the next tutorial.